Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗵𝗏 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗵𝗏. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗵𝗏 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗵𝗏 every Monday from 5 p.m. to 6:30 p.m. airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗵𝗏 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗵𝗏. I'm your host, Nicole Jacinto. With us today is Dr. Marian Quick. She's an infectious disease specialist from Makati Medical Center, of course. And we're here to talk about AIDS. Yeah, you got it, AIDS. It's World AIDS Day, and we're here to talk about AIDS, how we get it, what it is exactly, how our understanding of it has changed over time, what the latest medical updates about AIDS are, and all of these other things. And since Dr. Marion is an infectious disease specialist, this would definitely be her specialty. So welcome to the show, Dr. Quick. How are you?
Hello, Nicole. Glad to be back.
Yeah, I'm glad that you're back too. Okay, so Dr. Quick, today's World AIDS Day, and as we said, we're going to talk about it. Can you just start first, perhaps, with an overview of AIDS? What exactly is AIDS? For those of us who need to be reminded, for those of us who know people who have it or have known people who have even passed away from it, let's start with that.
Okay, so actually the World AIDS Day is every December 1st of the year. And AIDS stands for Acquired Immune Deficiency Syndrome, which is the more advanced stage of HIV infection. So the virus that causes AIDS is HIV, or human immunodeficiency virus. And for those people who are not on treatment, HIV can eventually lead to AIDS, which is acquired immune deficiency, as I mentioned earlier. So basically, what happens when you have the infection, the virus will cause destruction of your immune cells, specifically your CD4 T lymphocyte cells. And in the process of you becoming more and more immunosuppressed, as the virus just multiplies inside the body, then you are very prone to acquiring infections that a person who does not have an immunocompromised condition would normally not be afflicted by.
Okay,
so that's how it works.
Thank you, doctor. Okay, so let's start first with HIV. As you noted already, that there is a difference between HIV and AIDS. So if you are HIV positive, that is the virus that the human body acquires, and that's the human immunodeficiency virus. Now, once you have this, because there were there are people who have HIV but they don't have AIDS, and there are those who get HIV and have AIDS. You mentioned that if you do not treat AIDS, eventually you will get. If you do not treat HIV, then you will eventually get AIDS. So does it really progress to that, or can you live with HIV and not get AIDS?
If you were diagnosed early and you are on treatment, definitely you can have HIV infection without AIDS. Okay. So we always say that all people with AIDS have HIV, but not all people with HIV have AIDS. So it's a spectrum. If you are going to compare it to cancer, there are different stages of the disease. So there's actually clinical stages of HIV. Clinical stage 1, which is what we call asymptomatic, to the more advanced clinical stage 4, which is actually where AIDS falls.
Okay. So there are stages to having HIV. When you talk about treatment for HIV, can the treatment delay? Can it manage? Or does it cure?
It's like you're sick, you take antibiotics, and that's it. No, what I tell my patients is you're just putting the virus to sleep. And when you are on this medicine, we call them antiretroviral medicine. You're putting the virus to sleep, so you stop it from multiplying. And because they don't multiply, you don't get to destroy your immune cells. The disease doesn't progress, and in fact, you can prevent development of AIDS in people with HIV. So that's one of the goals. We want people with HIV to be living normal and long lives, on treatment.
Okay, so that's great, doctor. So there's no cure, but you can prevent HIV from
Progressing to AIDS.
progressing to AIDS. Okay, and as you said, if you would deal with it in stages, you gave the example that AIDS would be like the stage 4 if you would compare it to cancer, where that is, when everything already starts going haywire in your body. By the way, cancer is also an immune system disease, right? I mean, every cancer there's something wrong with your immune system. But
there are different types of cancer. In fact, there are some viruses that can lead to cancers, and there are some infections among people with AIDS that put them at higher risk for certain cancers.
Okay,
But
maybe
yeah.
Go ahead.
Yeah, no, go ahead. Sorry.
No. Absolutely. Please don't apologize. You are a wealth of information and education for all of us here. And that's why I'm so happy to have you back on the show to talk about AIDS. I think many of us are still very miseducated about AIDS, unless we've known someone or gotten into the nitty-gritty. And perhaps do you feel that in our society it's still taboo to talk about AIDS sometimes?
Yes, the stigma is pretty strong. In fact, in a recent study that was done locally, they found that stigma doesn't just happen among laypersons. In fact, healthcare workers even show stigma to people living with HIV. So that's one of the things that it's a barrier to people who may want to access care from getting care because of the stigma. And even the patients themselves can sometimes self-stigmatize. And that's pretty understandable because of what we are as culturally. There is a concept that people who got this, because of the way it's transmitted, they feel that, it's your punishment because of certain lifestyles and whatnot. Oh, did I get cut off? So there is that may konting hiya factor, especially since the majority of the transmission happens through sexual contact, and us being fairly conservative nation where sex isn't really talked about, that's a factor. That's one factor that prevents them from and adding to the stigma. And we always emphasize that with any other infection, this is not because you are sinful. This is not because you are amoral or immoral. No, this is just an infection like any other infection that you can acquire from someone who had this infection. It's just so happened that the route is through this.
Yes, it just so happened. That's so important to say that the route is through this. Can we talk a little bit more about, so the modes of transmission for AIDS? Can we talk a bit about what exactly they are? Because I mean, it's not just sexual contact, or what kind of sexual contact exactly, and then other ways of acquiring it.
Yeah, so sexual activity, whether it's male to male, male to female, oral, anal, they each have their risk for transmitting infection. So we do definitely the anal receptive intercourse, we call it, is at higher risk because of the it's more, there's higher risk for blood also in rectal mucosa versus vaginal mucosa. But generally any sexual exposure for that matter is a potential risk. The degrees vary depending on the route or the house of it, but that's one. And there are cases where you don't really have to go into the nitty-gritty sometimes with your patient. If they said that they have a prior sexual encounter, that's indication already for you to test. I mean, we're trying to remove the stigma of just testing, because even the test itself, sometimes I get referrals from colleagues because my colleagues who are healthcare practitioners do not know sometimes how to approach offering HIV testing. So that's one route of transmission. Now, other routes that we can actually intervene is mother-to-child transmission. So if you have an HIV positive pregnant woman, she can transmit HIV to her baby. And this is very important because there are ways for us to prevent mother-to-child transmission of HIV. And this is one of the avenues that's being targeted now as an intervention to addressing the HIV problem in our country. And then the other route, it used to be common before when we didn't know much about HIV, but blood transfusion, exposures to blood and body fluids, for healthcare workers, occupational exposure, like needle stick injuries, or for those who may be using injectable drugs and sharing needles. So this is another route of transmission of HIV.
Okay, doctor. I'm going to be a little bit more specific in asking my questions when it comes to the transmission. Of course, if you're not comfortable, you don't have to answer, but I mean,
No, I'm actually comfortable, but I'm not sure about your censorship. So that's why I'm keeping it rated PG.
Censorships are not an issue because we're talking about. I mean, I wouldn't say like, I wouldn't say, let's say, cuss words or anything, but in terms of censorship, no, that's not a problem. We're talking about health. Diba? Okay. So, so let's get into it. Let's talk about sex, baby. Let's talk about you and me. Okay, that was an old song for those of you who are still young. But yeah, definitely we're going to talk about it today. I asked about sexual contact, and basically, of course, maybe we can tie that to the stigma a little bit later on. I'll just repeat already that you said, of course, because it's of how the way we get it, and a lot of the focus is put on sexual contact between heterosexuals or male to male, female to female, whatever, whatever it is. So I'll ask you specifics. Can you get HIV from kissing, let's say, with your tongue and open mouth?
No.
Even if you have a wound in your, what if you just got dental surgery?
If there's a bleeding, to the concept of HIV transmission, you have to consider the body fluids that can potentially transmit the virus, which is blood, semen, vaginal fluid, breast milk. So if you notice, saliva isn't part of it. No?
Part of it, okay.
Then you have to consider the amount of the virus that you are exposing yourself to. So if the partner you are with, let's say they have HIV and they don't know it, probably are not on treatment, so their viral levels are probably very high. And then they have a bleeding sore in the mouth. Then, of course, if there is also, you don't know if you have bleeding area or gingivitis, then there is the possibility of risk there. But you also have to consider the amount of inoculum. So I don't know kung hindi naman siguro gushing you.
The amount of shaker, you're just like gushing blood.
So that's the reason why men who have sex with men, especially those who they have a practice called the top bottom. So the ones who are bottom, or meaning they're in the receiving end, so they are the ones who are what we call anal receptive. Because the transmission of HIV, so we said blood and semen, and very vascular kasi yung rectal mucosa. And it's not designed compared to the vagina, where you have natural lubrication and it can more or less, it's designed to accommodate a penis inserting in the vagina versus the anal canal. So there could be trauma that can happen during anal intercourse. So if there is ejaculation there and then there's semen, so let's say the semen, syempre, that's already one body fluid that can carry the virus. And then you add blood to the mix. and
Yeah.
injury. So that's why the risk is higher.
Okay. I'll elaborate a bit on that since we've gone there. Ask you more questions and please jump in anytime and correct me or whatever it is. Like, so basically you did mention tops and bottoms. Okay. So that's just our pop culture way of referencing people who are in the receiving end of anal sex. So a penis is inserted into a
Very
an anus. Okay. And in the anus, there's more, you said it's vascular. So meaning there's a lot of like
blood vessels down.
blood vessels. Okay. Blood vessels, veins. So it's more likely to be injured with,
Yes.
let's say, rough sex or whatever, any kind of
Or
sex.
even not rough sex if it's not lubricated enough. So those are factors that can add to that. You know, even just passing a hard stool, for example.
Yeah.
Sometimes, kung na-constipate ka, I don't know if that's TMI na, but for example, for some people who are constipated, sometimes nga, you can bleed out just from that hard stool passing out,
Yeah.
diba?
And that's from inside coming out. Like if you have hard stool, which feces or crap, then it sometimes there are people who are like, I got hemorrhoids or it's bleeding. So these are things that happen in the anal cavity. And in terms of so in terms of a penis being inserted into a vagina, you can still get, and as you said, there's semen, semen comes out, and then there's a wound, and so there's blood in the mix, the semen and the blood, that's a higher risk.
That's why it's higher risk.
Okay.
Now, you also consider length of contact, so contact time. And for women on the receiving end, so this is vaginal intercourse naman for women. And mind you, women can also engage in anal intercourse.
Yes.
Yeah, but for women, and let's say they do it the traditional like vaginal intercourse, even though there's no injury, there's still risk because vaginal fluid, semen, these are all potential, fluids that can transmit the virus.
So basically, a female through vaginal or maybe even intercourse can potentially transmit the HIV virus to a male, and a male can potentially transmit also the HIV virus to another male or a female with whom the male is having anal intercourse with or vaginal intercourse. And
in general, the one on the receiving end has higher risk than the inserter.
Okay.
But
yes.
One factor to that is the contact time with the infected fluid. So, for example, for women, the ejaculate stays inside the vagina longer versus, let's say it's the female who's infected after intercourse. And once the male has pulled out, then wala nang contact dun sa vaginal fluid. So that's
wear condom.
I'm sorry. Assuming they don't
wear condom. Okay.
Assuming it's unprotected contact. Yeah.
Yes. Can condoms do condoms really give you 100%?
Not 100%. No, there's nothing 100%. But definitely, yes, it reduces the risk of transmitting HIV, and not just HIV. It also reduces risk of transmission of other sexually transmitted infections like gonorrhea, syphilis, Hep C, Hep B.
Yes, I mean,
chlamydia.
Yes, chlamydia. I was gonna say, okay, doctor, go. You say you name them all. Also okay. So let's say going back to so we've dispelled the kissing part, but oral sex. Now, if cunnilingus is performed, meaning when a female receives oral sex, is there a risk there, and for whom?
There is a risk for the one giving head. The one giving head, performing the oral sex, because they are exposed to the vaginal fluids. It's not popular here, but in Europe they have what we call dams. So these are they act like a barrier for when performing cunnilingus.
Yes.
We don't have that here. Yeah. And then on the other end, the man, for those doing fellatio or oral sex for the male.
Yeah.
There is a risk more to, again, the one on the receiving end, because the seminal fluid is the one that carries the virus.
Okay. Question: if let's say somebody swallows the seminal fluid, does it get destroyed by the stomach acid?
Yes.
Yes.
But
okay.
yeah,
Just
yung transmission, yeah. The transmission of the virus
it's
is
still
not
there.
like because you
Yeah.
you ate it. No, it's not like
Yeah.
that. But if you have like areas there that we have been bleeding who came in contact with the virus, then you could get infected. Although the risk for oral sex is low, much lower than penetrative intercourse.
And for those who spit instead of swallow, this thing is the same. The risk is the same.
There's still risk, yeah.
Okay.
There's no 100% safe, except
Yeah.
in terms of acquiring HIV infection from sexual intercourse, the only 100% is abstinence, which goes against human nature.
Yes.
But for those who are able to do that, then okay, good for you. But you know, it's not human nature kasi. People
Yes.
will be engaged in sexual contact, no? And
Yes.
that's why we have what we call the ABCs of HIV prevention.
Okay.
So A is for abstinence. This is for sexual transmission. So abstinence. Of course, no sexual contact, then no risk of sexual transmission of HIV. And then B is be mutually faithful. Keyword, mutually faithful.
Mutually, yes.
Because you can be faithful to someone, but if that other person is not faithful to you, then there is a risk of transmission, of acquiring it. C is correct and consistent use of condoms.
Okay.
So,
consistent.
yeah. Because it has to be like all the time. It's all or none. If there are days, when you're trying to explore risk of a patient, so let's say someone went into the clinic and they tell you that sometimes they use, sometimes they not. It's as if not.
Because just takes once.
Yeah, sometimes it takes one exposure, you know. And then they don't do drugs because injection drug use can be a risk. Also, for those who are using illicit drugs or any substances, it can impair your logical thinking, and you may engage in more risky behavior than you would normally have if you weren't impaired in that aspect. And then E is education, very important. Knowing how it's transmitted can allow someone to do some modifications to their behavior, to their lifestyle, so they can be knowledgeable about how to prevent it. And then one of our colleagues, si Dr. Salvania, mentions FREP, but it's not FREP, it's PrEP. So
okay, yes.
Is pre-exposure. Para lang madaling tandaan, A, B, C, D, E, F, and says PrEP. But it's actually PrEP. So PrEP is pre-exposure prophylaxis. It's a medicine that we can give to prevent, not treat, but to prevent acquisition of HIV.
Yeah. Okay, doctor, we just have to take a short break. But when we get back, I'd like to talk more about PrEP because I was just watching. This was years ago. Watching actually a murder show. I love murder mysteries.
Oh,
they all did it right, and then but I got it. I learned about PrEP from that, but I'd like you to really educate me on it and perhaps inform our viewers about PrEP. We just need to take a short break. We'll be right back. Stay tuned. We're here with Dr. Marian Kwek, one of our favorite doctors on Healthline with Makati Med, and we're talking about AIDS. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Gia Season from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, Quality and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗠𝗸𝗁𝗵𝗹𝗁. Available for outpatient care services, our 𝗠𝗸𝗁𝗵𝗹𝗁 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗠𝗸𝗁𝗵𝗹𝗁 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗠𝗸𝗁𝗵𝗵𝗃 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗠𝗸𝗁𝗵𝗃.
You're back with Healthline, keeping you healthy, moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We are here with Dr. Marian Quek. She's an infectious disease specialist, and we're talking about AIDS. Now, earlier we were just talking about sex, but it's still related to the topic, of course. We weren't just having a chit chat here and there, but it's such a natural, as the doctor mentioned earlier. Sex or sexual expression, engaging in sexual acts is it's part of human nature. So we were talking, doctor, earlier, and we were talking about how there's still a stigma in our society surrounding talking about AIDS, HIV, or even treatment because of the modes of transmission. I think it's very important. I'd like to emphasize what you said, the modes of transmission of HIV. And there's a lot, of course, it comes with different types of sexual contact or sexual acts. But, it doesn't, I think, as you said, in our society, we're very conservative. We don't talk about sex. So there's a lot of stigma surrounding it. And may I also ask, just to clear off that topic, are there any, because I know this will somehow play into it, and perhaps some people might automatically feel judgmental, which they shouldn't, and some others might feel judged, and we want to know that we're here for them. Are there any particular demographics that are more vulnerable, or as of today, as of your studies, as of your experiences as an infectious disease doctor and treating people with HIV or AIDS, are there any demographics that are more vulnerable to acquiring HIV or AIDS?
Yeah, so there are certain key populations who are at higher risk and are more vulnerable. So you have your men who have sex with men. They are the leading, in terms of new cases, they are usually the ones that have the highest number. But we shouldn't forget those also transgender individuals are also a vulnerable population. They already have stigma, sometimes within their community as transgender. And then that adds to that pa. And then the youth also is a vulnerable population. Children's sexual debut is becoming younger, and you pair this with a lack of information, then really that's just a lethal combination. And those who engage in transactional sex are also at risk. People in correctional facilities also at risk. So these are just some at the top of my head that that would form a lot. I could be forgetting, so I don't know, for our listeners, maybe they can comment if I've missed a certain key group.
Yes, please.
Those are the usual.
I mean, perhaps. Well, you said transactional sex. So that would include sex workers, those who also who patronize the sex workers. People in
they don't even have to be like commercial sex workers. Like they are those who, in exchange for something, kaya it's a transaction. Eh.
Yes.
You have sex for a certain, whether it's an item or other, it's a trade-off of something. So people are also at high risk.
I'm so glad you said that.
Oh, and I remember, of course, people who are have substance dependence are also very vulnerable.
Yes. Substance dependence. Okay, so I'm very you've got a thorough top of the head, the correctional facilities. I mean, because it happens there. People never think of that, but there's trade going on there, and the need for sexual expression or the power, and also power that's traded with it, and just rape. I have to say it. Stop raping people. So that happens in correctional facilities outside of it. So it happens. So maybe those are the people that should be judged, the rapists, for raping people. Those are the people that, if you want to judge them, because it's about power and oppressing someone else. But for the rest of the people who have sex whatever way they want and whatever way they choose, it's just cautionary for them. The same way this is my opinion. If you disagree with it, please go ahead, doctor. I'm just saying it like to reach out to our friends or our community there who know people who have HIV or AIDS, or for those who have it themselves or have known people, who have had even friends or family members who've passed away. It is so, people are so quick to judge.
Yes. And unfortunately, and that's the reality, but we're trying to do all the effort so that people do not put a lot of stigma. Stigma kills, really. Because imagine if, in other parts of the world, doing an HIV regularly, when you offer HIV testing, they can tell you when they last had it done. It's not a big deal. It's like you ordered a CBC. Ganon sa kanila eh. And can you imagine all those who are at risk, who may have been caught early or diagnosed early, but they were afraid to get tested because of what people would think? Kaya talagang it's the stigma that kills eh. At least that's what I think.
Yes, and a lot of women in this country, and I know a lot of you, you find out your husband is fooled around on you, get an AIDS test or get an STD test panel, because so you're married and all of that, but you have the stigma. Oh, I don't want people to think that. So it's not you who did it; it's him. So but he could have done it with anyone, and that person, it can take once, it can take twice, even if it's his longtime mistress, it can happen. So anyway, sige, wag nang humugot. So
parang may hugot ba yan?
On behalf
current events,
on behalf of many people, may hugot yan. On behalf of many people, and the people who are watching me now, and some of my friends and family will laugh when they do understand. On behalf of you guys, and may hugot yan. Also, so that we've talked about the demographics that are, of course, and so the people who use drugs, people generally judge them anyway, right? So we have these judgmental, or sometimes people in the guise of religion, using their own judgment to come up and say, well, they deserve it because this is the kind of lifestyle they lead. But other illnesses and diseases, which are also horrible, do not choose.
Yeah.
So it's the same thing.
Saka, you know, if we were in biblical times,
Yeah.
I'd like to think that Jesus will probably be hanging out with the apostles, because
Yes,
he hung out with the lepers during his time, right?
exactly. Hung out with the
And,
leper.
you know, the stigma that they were facing then is comparable to the stigma. And the Pharisees were the ones who are also, you know, parang nasa, di ba, nasa parang ano
Yeah.
yung Jesus very angry with the Pharisees kasi nga, he called them hypocrites, di ba? I'm not a
Yes.
very religious person, but that's at least what I think, no? Syempre, I
Yes.
still
I agree
grew
with
up.
you.
I am Catholic, although I'm
Yeah.
not really yung talagang sagrado na sinasabi
Yeah.
nga ni, because, you know, Jesus said, who are we to judge, di ba?
Mhm.
And for him to, probably if he were alive today, I mean, if he were with us at the moment, baka kasama siya dun sa mga nagmamarch, advocating for the
Exactly.
rights of the PWH, people with HIV.
Well, Jesus hung out with lepers who were physical and social pariahs because leprosy, if you got it before, there was no cure. So they'd
Mhm.
really like just go live by yourselves, condemn them to whatever horrible life they'd have with their sores. And, how do you get leprosy? Actually, I don't know. I think you know how, but it wasn't through sexual transmit, or the modes that we just automatically judge on now. Also, there were many people who were just social and who were social pariahs during his time. Um, Widows sometimes were considered social pariahs. People from other widows who weren't like properly, parang whatever then, because only a man can work. You know,
Mhm.
their husband left them with nothing, and whatever the hell it is still happens nowadays. But he would hang out with those people who weren't of the same religion, who weren't of the same upbringing, and that is why it was so important, because that example is so important because he did not judge people, and he wasn't there. He wasn't there to keep strict to laws and things that were written for certain reasons naman. There were good reasons for certain laws to be codified and put there, like for example, if you think of it scientifically, like the restrictions on eating certain kinds of food. Sometimes they will say you can't, if you adhere to it strictly, you can't eat shellfish or you can't eat pork. Well, because pork, the pigs and the wild hogs would eat anything, even people. So people are discovering that you kind of are what you eat. What if it's shellfish? Because you can only eat the fish with scales. Because what if they had allergic reactions? And there's no refrigeration pa back then. So there some of it makes sense, in a scientific manner. But now that we have refrigeration and all of that, and we have, or you still don't want to expose yourself to poison or allergic reactions. But people don't think enough, including some of our people who just want to keep it all strict because they are able to live through that. It's an indoctrination. But our Pope is if you're Catholic, the Pope right now is very, very, I think, intelligent, and he has a good heart, and he's a good example. Things change with the times.
Yeah.
Okay. So anyway, thank you, Doctor, for listening to this. Okay, to my friends who are priests, they know me anyway. They get that. Okay, you may now rise.
There are actually certain groups then, Catholics, who are also advocates. Not everybody naman, just because they're religious. We don't want to generalize, but there are some. I have met people then who, turn away positives and write them out automatically.
Yeah.
Kasi you're living a sinful life. Parang ano tayo, we already know that it's a germ, it's a virus that caused it. We're no longer in the Stone Age na, kaya nagka-infection kasi meron kang ginawang masama, ganyan, di ba? So,
yeah. I happen to be a Catholic also. And I'm just perhaps more open-minded in general than some other people are. Actually, of you'll find it in different religions, the biases, not just in ours.
Yeah. I can only speak for ours kasi syempre,
Yeah, other people will get offended. Unless they're a bunch of my group of friends who keep arguing all the time. We're like, oh my God, okay. Literally. Okay, so anyway, doctor. So that is why that touches on the stigma, that does touch on the demographics. And then we talked about PrEP, no? Perhaps perhaps we can talk about PrEP or FREP as your as the other
sabi ni Doc Edsel yun, PrEP.
A, B, C, D, P. Hindi pa. A, B, C, D, E, P. Hindi, mali. So, A, B, C, D. Okay. Well, okay. What about PrEP? As I said, I saw it on a show many years ago. And I was like, that's very interesting. I was so impressed with, and I was like, what, 10 years ago or more? Or, I mean, I'm ignorant about the, how it came to be. But please tell us about PrEP.
Yeah, so PrEP is a medicine. So it's a pill that contains 2 drugs inside it. To describe it's 𝗪𝗁𝗶𝗵 and 𝗠𝗸𝗁𝗵. So when you are on this medicine, so for men, they can take it as daily PrEP, meaning you take it every day. And there is also event-driven PrEP. So for those who, this is event-driven PrEP is only for men who have sex with men. So this is when you anticipate a sexual contact. And then 2 to 24 hours before that contact, you will take the pill, 2 double dose of that pill. And then the following day, you take 1 pill. And then another day, you take 1 pill after that, no? Assuming that was just 1 contact. So basically, this medicine prevents you from getting the HIV infection yourself. So there are certain key populations where this is something that you would recommend. So one of them, there's very good data, especially for those who are what we call serodiscordant couples, meaning you have a partner and then one of you is positive for HIV, the other one is negative. So, syempre, if they're partners, no, so you would expect that sexual encounters would happen. So when they found that when they gave this medicine among those who did not have HIV and they were taking it with good compliance, then they were able to see that a lot of them were more than 90% of them did not acquire the infection. So other yeah, this is very good as prevention.
You mentioned that where you take it every day, where you take it consistently every day.
Yeah.
You know,
for those with, in a relationship. No, may mga iba kasi na they're not in long-term relationships. So this is only applicable to men who have sex with men. I'll talk about why later. But for men who have sex with men who do not have a regular partner, but they do engage in maybe casual sexual contact, or one-night stands, mga ganon. So if they anticipate an encounter, they can dose it nga as 2-1-1. No?
2-1-1, okay.
Yeah. The reason for the difference, kasi for women, you can't do that. For women, or even transgender women, you can't do that event-driven PrEP. So they really have to take it daily. And this is because the protective effect of once you take the medicine, no, for women, matagal kasi before you establish or reach a protection level. So you have to be taking the medicine for, I think, around 20 days. So 3 weeks. Before you have protection in the vaginal tissue, versus for rectal tissue in men, mga 1 week from starting the PrEP, you can already achieve protection.
Okay.
No? Tapos yung elimination ng drug, usually you stop 28 days after last exposure if you're on a daily PrEP. So may mga ganong scheduling lang. This is, medyo specific na yon. So this is something that's best discussed with your provider.
Yeah, how long has it been around and available? And is it easily available now with your healthcare providers? Can you
so any treatment, I mean, it was rolled out locally, I think fairly recently lang, maybe mga 2-3 years, if I'm not mistaken. So this is available in your treatment hubs. So when you talk of treatment hubs, these are sites that are accredited by the Department of Health in providing HIV care, whether it's a primary care facility or a hospital like Makati Med. So in our center, we do have access to PrEP because we are a DOH accredited treatment hub. But the thrust now also, there are also a lot of community-based facilities, and they do have access to PrEP as well. So the medicines for PrEP are provided for. You can access it for free. As long as may mga paperwork lang yun, basta you access them in your treatment hubs, and then they'll manage the paperwork for that.
That's great. That's great to know. And I hope a lot of people like this information spreads and that you actually use it to your advantage. Don't judge yourself either. You said earlier there's self-stigma. Yeah. So no, don't get down on yourself. And
now I always emphasize then the PrEP is just to prevent HIV. So if you're going to engage in risky behavior, like risky sexual contacts, you still have to pair it with the use of condoms. Kasi nga, you are protected from HIV, but you cannot get protection from, diba? Gonorrhea, chlamydia, syphilis, and all.
Get an unwanted pregnancy. Yeah. Okay. Yeah.
It
so
has to be together.
It has to be done together. It should be done together. Best way to prevent any sexually transmitted disease or perhaps an unwanted pregnancy. If you're going to engage in unprotected sex, well, just don't engage in unprotected sex. Go protect yourself all the way. No, doctor. Okay, doctor. We just have to take a short break, but when we get back, I would like to ask you more about. We've talked about preventive measures for getting HIV, and also to an extent AIDS, which is to treat the HIV, and that would be get tested, but also like how do you diagnose it? How all of these things, like when does it pop up? When do you start getting this aha moment? This person may have HIV, may be HIV positive, or may have AIDS. So stay tuned, folks. We'll leave you with that hanging question, and the answer will come from Dr. Kwek once we get back from this short break.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗍 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access. Hi, this is Dr. 𝗂𝗍 and welcome to Makati Med Wellness Center. Located at Ayala North Exchange, the Makati Med Wellness Center is a warm and comfortable state-of-the-art lifestyle center where executive checkups and services that address holistic patient care and wellness can be done. We have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. The Wellness Center is equipped with modern facilities and staffed with competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services for both adult and pediatric patients alike. This is a great place to prioritize your health and well-being without having to be at the hospital setting. We are open from Monday to Saturday at 7 a.m. to 5 p.m. at the 7th floor of Ayala North Exchange Tower 1 in Makati City. It is also accessible from the Makati Med Hospital through a bridgeway to Ayala North Exchange. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Wellness Center.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med, folks. I'm your host, Nicole Jacinto. We are here with Dr. Marian Kwek, who has guested on the show before, and we're very happy to have her back on the show today. We're talking about AIDS, HIV. We've talked about its stigma, ways to prevent it. And now we're going to talk about how exactly it is diagnosed. Before we went on a short break, I asked you, doctor, how do you diagnose AIDS? And like, is there an aha moment when you're like, this person is getting sick all the time? Or does the patient or does the doctor kind of have an aha moment when they're like, this may be HIV or AIDS? Oh, I think
I'm on mute pala. Before we go to the diagnosis of AIDS, siguro I'll emphasize more about early diagnosis.
Sure.
Similar to hypertension kasi, what I always tell them when I lecture, when you start showing symptoms already, it's probably. So for hypertension, you have to measure your BP for you to know if you have hypertension. There's no other way. You can't say, laging masakit yung bata ko, may high blood siguro ko. It's not the way to do it. You really have to measure. In the same manner, for you to say that someone has HIV, you have to test for it.
Okay.
So if you don't test for it, even though you're asymptomatic, kasi nga, we know that at the start, you may not have symptoms at the start, but you're already infected and you can potentially spread it. So early testing is still recommended. So if you have any risky behavior, and mind you, a lot of people underestimate the risk. So lagi ko sinasabi, basta nagkaroon ka na ng sexual encounter, just do it as a habit. You can do it annually, just part of like in the same way you do your annual X-ray CBC analysis. You can do it on your own, like annually. Or if you do engage in more risky encounters, or rather you have a higher risk for it, you think, let's say you do injection drug use and you share needles and all those things, or sexual encounters unprotected, then you can do it as frequent as every 3 months. Okay. Now, from a clinical standpoint, when someone is manifesting with, you're correct, no? Parang laging may sakit, weight loss, these are alarm signs. Although these can happen to other diseases.
Yes, other symptoms of other diseases.
That's why if you are considering, any workup for recurrent infections will always include an HIV test, no? Kasi that's something, there's no harm in testing, but there's a lot to gain if you're able to diagnose it, right?
Yes, and you did say your immune system becomes more compromised. It's compromised.
The longer you get the infection. Yeah, so you can have a latency period of 10 years in some, but local data have showed that it seems that in our country, we progress more rapidly. And there are several factors to this. One is the type of strain of HIV that we have seems to progress faster. And also because of the high TB burden in the Philippines. So TB and HIV together is a recipe for disaster. Kasi the TB itself can also deplete these CD40 lymphocytes. So when you have it together with HIV, which does the same. So there's really, that parang na double whammy ka with that.
And then, okay, so doctor, very good. The emphasis is on testing. And I mean, if you've had sexual contact, you can do it. You're qualified to do it. Or also in terms of, so the diagnosis is really the test. That's how you diagnose it. There are moments when if you keep getting recurring infections, and these aren't just, you said they could be symptoms of other diseases or illnesses as well. However, since your immune system is compromised, can you talk about the relationship between having HIV or full-blown AIDS and getting different types of illnesses? Like you just mentioned TB now, like perhaps other illnesses as well that tend to like wear you down when you have.
So there are certain infections that, I mentioned earlier, I alluded to a clinical staging. So there are some infections that can happen. So if you have HIV plus this condition, then you would say, oh, you're clinical stage 2, 3, 4, and whatnot. So for example, diseases that are commonly seen in the elderly, like shingles, which is a recurrence of herpes zoster or chickenpox recurrence, yung pain. So it usually presents as a rash, and it's common in the elderly elderly population. So if you have a young patient presenting with that, they're not supposed to get that usually at age. So that's already a time for you to offer testing, because shingles in a young person with HIV is already clinical stage 2. They can present with HIV clinical stage 2 would include shingles already.
Sorry, the youth, or a young person, until what age would you call a person young? For the sake of this.
For the shingles, kasi the data for shingles, higher risk. In fact, the vaccine recommendations for shingles is more than 50. So someone who's less than 50 who has shingles, you usually offer screening. And then they can also present with like fungal infections on the face, skin, and for others naman, there are certain types of infections that when they have it, more often than not, it's AIDS rather than something else. So there's a certain type of meningitis called 𝗪𝗏 that if you have it, then the possibility of that person having AIDS is high.
Or did you say meningitis?
Cryptococcal meningitis. Cryptococcus is a type of fungus. Not just any meningitis, but cryptococcus, once you see that, there's what we call AIDS defining conditions, meaning if you have this, usually advanced na talaga yon. And you know how HIV was detected in the 80s. So there is a fungal pneumonia called pneumocystis pneumonia.
I will ask you about the history of that. So now that you've mentioned it, let's go there.
Yeah. So there's a type of pneumonia, fungal pneumonia called pneumocystis pneumonia. And in the 80s, they found that why are these young men healthy, supposedly, they're at the prime of their lives, 20s, 30s, why are they having this type of pneumonia? And they're not supposed to get it. This is usually a disease reserved for the extremes of ages or very weak individuals. So it only started like a few reported cases of young men with this type of pneumonia, until eventually they found, in this area we have this also, and this one. So parang it became a trigger for research, and then there were certain commonalities. So that's how you do parang investigation din yan. So okay, you have a unique group, you try to find commonalities, what's common among them. And a lot of these men were men who also had sex with men. So that's why in the old days, pero 80s lang yun, not so long ago. But that goes to show how far we have progressed, no?
Yeah.
From that time. They used to call it the gay disease, which we now know is false. But it's because they were the initial group of individuals where they found this illness. Kaya naging ganon. So those with pneumocystis pneumonia, again, that's also suggestive already of advanced HIV. Yeah,
Okay.
so that's just one. There's a lot of them. Mauubos ang oras natin if I discuss each and every one of them. But those are just some of them.
As to the history or the discovery or us naming this HIV and AIDS, I would assume that they found it in a group of men having sex with men, but I would assume they found it in a more advanced country and started putting
Yes.
pieces together, and then
Yes.
they realized these men were traveling to other countries. I mean, or had been exposed to other groups in other countries. And they discovered that, you know, when they got to where it may have actually started or how it may have started, and we were given so many stupid, like, we were given so much stupid information, like I don't even know, you know, like when I was a kid, I thought they said it started because people ate monkeys' brains or something like that, like. And then somehow, you know, so I was like, so how did it get to people? But even that you know, then you can't call it a gay disease because who eats monkeys' brains? I mean, a lot of people do, you know, and there were all of these
Marami na yung progress sa HIV. Definitely, we know a lot of the practice also as far as treatment has changed from its inception up to the present time. So,
but do you believe, I mean, did it start? Is it an illness that we got out of? I mean, is it zoonotic or just something, you know, like that happened? Like we cannot trace whether it's zoonotic or it's
hindi, that's just a theory na parang it jumped species kasi merong parang simian na immune deficiency din. But I don't think that's from eating the
exactly. See how stupid the things we were told were. I mean, when doctor says simian to, oh well, that my nerd friends who have watched all the Planet of the Apes know that simian is like.
What I know of lang, I could be wrong, but from what I know, from what I've read before, is really exposure to the blood ng mga naghahan.
Yes.
Yeah.
So, you know, things often start that way. Okay. So, I mean, like, there we have it. Like, so we don't know really where it's from. Sure, there's something similar in simians, but we don't know.
Sabi na, I think there was also like,
people had sex.
They had sex with monkeys. Ganong, but those aren't true.
Well, they keep having sex with sheep as well, but I don't see any kind of AIDS type of thing happening there. Yeah. Okay. So there. All right. So yeah. We at the end of the day, we don't know. It just happened to come up, and
they say that it may have jumped species, but as to the how, parang in the same manner as how other viruses that have jumped species,
like even COVID, right? I mean, yeah, they just wanted to then the stigma that I guess what I'm getting at here, really, in a way of just discussing it, is get rid of the stigma around HIV and AIDS, because, you know, people didn't have sex with pandolins and then therefore got COVID, or for all we know, they died. I don't know, you know, like. It's sometimes it gets ridiculous, doesn't it? It's just a way of judgment and the stigma. And for those who want to get tested, and no, please, I remind you, go there. Caring healthcare workers.
It's just a simple blood test, no? And there are certain sites that are accredited to do same-day diagnostics. Before, we used to wait a month before we got test confirmation. Eventually, there have been changes in terms of how it's diagnosed. So there is a rapid HIV diagnostic algorithm that we use, where you can diagnose someone on the same day. Some changes also as far as management. So just walk you through the history of the treatment. Before, kasi when the medicines were available, the medicines that we had weren't really as good. So dati, what was recommended, at saka yung supply was an issue. So before, the recommended population to get ARVs those are already immunosuppressed, no? After a while, they up the levels of the CD4, yung sinasabi ko CD4 count, which is your measure of your immune state. And they increase it to those who have less than 350. And then later on, research showed that when they gave the antiretroviral medicines to people with HIV who had higher CD4 counts, they found that they had higher CD4 in the long run. They have faster time to viral suppression. There was less morbidity and mortality. And that changed the recommendation to starting antiretroviral drugs earlier. Now, in the goals of HIV, so there's a universal goal by UNAIDS where we are targeting that 90% of people with HIV are diagnosed, 90% of them are on treatment or linked to care, 90% of them should be virally suppressed. And they found that around 80% of people with HIV may not know that they have it. And out of 81%.
81% of people who have it may not know they have it.
Know that they have it. So,
okay.
81%. So, it's not 90. So, based on literature, ideally, di ba gusto mo 100 sana?
Yeah.
Lahat ng may HIV should be on treatment. So, only 81% know their status. And among that, mas less pa yung on treatment.
Yeah.
So, they found that if you are going to wait, sometimes you diagnose, you test someone, and then you wait a month for a result before, or even same day, and then you ask them to do other things, labs, etc. Parang minsan nawawala yung patient na yon. Kasi that opportunity for you to have diagnosed them at point of care is already an opportunity to treat. So ngayon, hindi na tayo naghihintay, immediate treatment na. Once you test them, they're positive, start na agad as much as possible. That's the trend now. Immediate.
So these are some of the advancements, doctor. Like, I mean, before they would have to be at a specific range where
number. Yes.
You can only receive this now because of the difficulty in getting it. Now, as soon as you find out, and you can find out,
diagnose, test and treat.
Test and treat.
Yeah. And they found in their studies also, kasi once you achieve viral suppression, meaning when you measure the virus in the blood, you can't detect it anymore. Kasi nga, pinatulog mo na eh. So you can't detect it anymore. There is what we call, there was a campaign, U equals U. Undetectable is untransmissible. So the faster you treat persons with HIV, the faster you would achieve viral suppression. And you also lessen the risk of them passing it on further. So HIV treatment actually is also a form of public health intervention. Kasi nga, you are addressing the communicability of that person eh. So when you are giving them treatment and they achieve viral suppression, usually by the 6 months, suppressed na yan for the most part, no? If you're not resistant to the drug, for the most part, you're virally suppressed by then. Then, hindi ka na nakakahawa. And that's a good thing, right?
Doctor, let me ask you this really quick because earlier I forgot to ask you. You did say mothers with AIDS can transmit to their babies, no? Is that through when they're in the fetus or when they give birth? And can you
ask all of them, from in utero, delivery, to breastfeeding.
Breastfeeding, okay.
So at all points, there is that risk of transmission. So how do we prevent mother-to-child transmission? So, kunyari hindi pa HIV infected si mother, but the husband is HIV positive, and this is planned, no? They're planning to have a baby. So, for the male na HIV positive, so let's pretend you have an HIV positive guy and an HIV negative woman. So the man has to be on treatment para he's virally suppressed. Okay. Because when he's suppressed, he's not infectious anymore. Okay. But you can add another layer of protection by giving the woman PrEP. Kasi nga discordant sila eh. So, if the mother was uninfected during the course of, creating that baby, then syempre, HIV negative mother, HIV negative baby. Now, what if the mother is HIV positive? So, if the mother is HIV positive, you have to treat the mother with the HIV medicines so that her viral levels are also suppressed. So, pag suppressed na yan, parang less yung risk of transmitting, but there is still risk, no? So when a baby is born to an HIV positive mother, then there's also parang prophylaxis given to the baby.
Oh, okay.
So that you can have an HIV positive mother, but the baby is HIV negative.
So these medicines are not like the ones where you say may be dangerous for pregnant women. No, they're actually okay to treat the pregnant women and the babies themselves once they're born. The prophylaxis.
So may mga iba lang na preparations, dosing, syempre, and formulations. So our pediatric colleagues are the ones giving the prophylaxis for the babies, but they are available.
Yes. Thank you, doctor. I just, forgot to ask that earlier, and
very important. I'm glad you asked that again. And also, this is a call also for our OB colleagues. Yes. Because I have encountered persons who have had children but were never tested for HIV. So, in the same way as routinely tinetest po for pregnant women yung syphilis, yung hepatitis B, there should be no stigma in ordering the HIV test.
True.
Because there is something you can do. There's an intervention you can do to prevent further transmission. Kaya lang sometimes when talking with other colleagues, kasi ngayon medyo mas wide na yung practice. Before, when I was just in training, I would encounter more pregnant women who are not tested. Nowadays, mas marami nang natitest. But there are people who still get offended when they are offered to test.
Yeah.
So that's another part of the stigma itself na ayaw, ba't mo kayo test? Minsan, may mga patients din na nagagalit when you offer testing. So you just try to offer it as a standard of care.
Yes. Yeah, by the way,
ito po yung listahan ng kailangan namin gawin. Yeah. Kahit sabihin nyo ayaw nyo, pero, actually, no, erase that. There is consent required. Pero as much as possible, you talk to them na these are the benefits, no? Yes. So, hindi nyo pwedeng pilit but these are the benefits and you have to discuss it with them. In the Philippines, you cannot test someone without their knowledge. Bawal yun. We have a law prohibiting you from testing. Even as doctors, kahit kung tingin talaga namin meron, you cannot do it without their consent. No, that's they have a law protecting them. And this is different to this is unique to us kasi in other countries walang ganon, no?
Yeah, they can just test for whatever.
Yeah.
It's not an invasion of privacy, but then
like for example, you're admitted and the doctor wants to do this test.
Yes. There are cases where they do ask you
battery of tests. Like for example, you do a CBC, hindi mo naman ipapaalam, papa CBC, papa X-ray kita. Hindi ka ganon. So here you have to secure consent.
When it comes to AIDS tests only, or like
HIV testing is you have to have consent.
Okay. Well, then how far do you think that like education and how can communities as doctors, obviously, and like you were calling out to your fellow OBGYNs, but okay, the patient might get offended. So how do you think like communities and hospitals, doctors, of course it starts from you, or maybe the big pharma who also benefit from this, maybe they can start things. How important is education and just informing people about this? And I hope we're doing it on this show.
Yeah, I hope so too. Ideally these are things that you are also taught in schools.
Yes,
I would hope. But just talking about sex in schools is that's another
until now.
Another entirely, hindi pa siya ganun ka-widespread. And we do have advocates for that as well, na you have to educate them early, And that's one barrier to educating about HIV, because you can't talk HIV without talking about sex. That's part of it. That's a big chunk of HIV topic.
Children should be educated on it. I think it might prevent even a lot of cases of sexual abuse for children when they don't know like what's happening, or or sexual harassment. And I mean, by the time they try to bring it up sometimes in like high school, people are it becomes like a snake. Because I've personally been in a class where they've tried to put like a religious spin on it, like this is not like, drawing body parts and Xing it out. And I'm like, but that doesn't happen in real life. And then if you say something like that, they're like, you must be a harlot at your age. And you're like, no, I just I'm just using my brain, right? So that's why we have stigma. So education is so important. Come
Yeah.
on,
And
government,
if we're not gonna educate them, they're gonna get their information somewhere.
somewhere. See
Diba?
my speech on the right.
Maybe correct, maybe not. So if ever they would Google something, I recommend going to reliable sites.
Yes.
No,
Okay.
kasi,
You can
yeah. So you can
go
go to sites like UNAIDS, HIV.org, of course, yung mga CDC, WHO. These are sites that, you know, you can get more information. DOH, yung website lang natin, hindi masyado pang maraming info. But some basics are there, no? But some nitty-gritties, there, you can also access, I mean, the internet nga, information. If you know how to use technology, then good for you. The information is there. Pero syempre, hindi kasi lahat applicable to our setting. Kaya it's also good then na you get information here locally from.
Yes. Also, okay. In terms of you've made advancements in how you treat it and how you deal with it, the approaches. I think maybe also a lot of people have tried to make advancements in terms of not just dealing with the stigma, but getting people to be treated, no? And a lot of people have tried to really changed and just not been following kind of a pattern of unreasonable conservative views in some manners. But in terms of access naman, can I ask you about that? Like, when it comes to, okay, well, we've established that there's a lack of access to information on the school level pa lang. But you said you can use the internet, but go to reliable sites. How about lack of access in general to medication or, the factors come in like income, socioeconomic.
Yun, that's a very big barrier, especially in our setting. So, yung mga medications for HIV lab tests, these are actually covered by PhilHealth, which is yung outpatient HIV/AIDS treatment package or OHAT, and they have a reimbursable amount of 7,500 per quarter for claims a year. So that's around 30,000. But, admittedly, that's not a lot. But, for the basics, can suffice. It can cover your medication, consultation, ang mga limitation, and pertinent labs. The problem lang is if you get someone more advanced, and they would need, because you have to treat what we call OIs, opportunistic infections, kasi nga down yung immune system, di ba? So maraming opportunistic infections. So you have to treat those on top of the HIV pa. So let's say someone with cryptococcal meningitis o fungal meningitis, hindi naman covered ng PhilHealth. Hindi mako-cover yung ibang mga gamot. That won't be enough. No? So definitely that's really a big barrier talaga as far as access. Kaya nga we would want prevention and early diagnosis and early treatment.
Doctor, you're really so very thorough, because it's not just the HIV, the aspect of having HIV or AIDS that you addressed. Oo nga, you can get covered. Thank God, thank you, the government, and for doing that. But as you said, the opportunistic infections, like nagka-pneumonia ng ganito, or like that's not covered. So how do you treat the patient who is from a lower socioeconomic in the level? In the meantime, when even the people in the highest economic levels are like dying just to pay.
And then the mental health aspect of it is also not covered. Like a lot of people with HIV do have mental health conditions. In fact, that's one of the main reasons why some people on treatment stop taking their meds. Na-depress sila, and parang they just give up sometimes. And these people, they also need access to psychiatric care, but that in itself is another, a topic entirely.
And another stigmatized thing also as well, Doc.
Yes. So, marami talaga limitations, but, we advocate groups, foundations, and, the community are really coming together and hopefully address these different barriers to care.
Please come back on the show to discuss it. If you'd like a show just about discussing the mental health implications of having AIDS or other illnesses, let's do that. This show is meant to to help people. So, let's do it, Doc. Wherever you guys see any gap you'd like to fill or any way that can help people, please just, come back on the show and we'll take it up then. And we are running out of time, but Doc, please, I leave the final words to you. What do you want to say about how you're looking forward to AIDS, or what advice can you give people, or just anything you'd like? And if you want to say hi na rin.
Yeah, there's access to preventative care. And, hindi mo kailangan pumunta sa hospital. There are a lot of primary care facilities. You can look at the website, search DOH Treatment Hub Philippines, and you'll have a comprehensive list. There may be somewhere close to your area where you can access testing and treatment if needed. And Makati Med, if you're in our area, Makati Med is a treatment hub. So we also have access to these medications, and we do have the specialists available.
Okay. That's all? Want to say hi to anyone?
Hi, Lawrence.
Okay.
Hi, CTTM family. CTTM is our treatment hub in Makati Med. So we do have our staff, Daisy, Myla, Iris, Jen.
Hi, guys. Maybe I'll bring people there.
Sir Marvel, Phil Health, Sir Neil, Service Ops.
Okay, hi, guys. Hi, CTTM Hub. Maybe I'll bring people there to get tested. Maybe they want to get tested. It's the problem.
Yeah.
Here we go. Okay.
Yeah.
Thank you so much, Dr. Quack.
Thank you for having me.
You
extend yata tayo, but it's my favorite topic, so I tend to run my mouth when HIV is the topic.
Your mouth wasn't speaking it. Not at all. Let's do part 2 soon,
Yeah.
huh? Okay. Really, we need to keep putting it out there. Keep putting good vibes out there. Thank you, Doctor. Thank you all for watching. Please watch as many times as you want. You've got a great resource person here in Dr. Quack. It's time. We'll see you next week on Healthline with Makati Med. Doctor, thank you so much for being on the show.
Thank you. Bye-bye.
See you again next time. Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not